Before I introduce our two guests on the industry perspective, I first must thank Thermo Fisher Scientific Group, who had agreed to sponsor this particular panel. They were also unable to attend, apparently, so I've been asked to say just a few words about them. Thermo Fisher Scientific Group is a world leader in serving science, and they operate in 50 countries, assisting their customers in things such as accelerating life science research, solving complex analytical challenges, and increasing laboratory productivity. And they do this through innovative technologies, purchasing convenience, and comprehensive support to their members. So we thank them for sponsoring this session and for being a supporter of an integrated food safety system. So I told you this morning that one of the major purposes of this was to do outreach with people that we didn't do it very well with back in 1998. And that was industry and consumer groups. And so we wanted to give industry a forum here to offer their support, their concerns, their criticisms, whatever they want to do relative to our effort to integrate the food safety system. When they are finished, we will invite, I know we have a large number of industry people here, and I would encourage and invite you folks to as well come up to the microphone, and if you have concerns, we really would like to hear them. I'm not sure we can answer all of them today, but we want to know about them so that they can be addressed. Our panelists for the industry perspective, first will be Jim Gorney. Jim is currently the Vice President of Food Safety and Technology with the Produce Marketing Association. He was formerly a Senior Advisor for the Office of Food Safety at the Food and Drug Administration, where he advised staff on policies and programs affecting the safety of fresh produce. Prior to that role with FDA, Dr. Gorney was the Executive Director of the Post-Harvest Technology Research and Information Center at the University of California, Davis. He also served as Senior Vice President of Food Safety and Technology for the United Fresh Produce Association. Following Dr. Gorney will be Dr. Jennifer McIntyre. She is currently the Vice President of Science Operations with the Grocery Manufacturers Association. Dr. McIntyre was previously Vice President and Chief Science Officer at the Atchison Group and the Senior Staff Scientist and Director of Science and Technology Projects at the Institute of Food Technologists. She's worked closely with FDA, FSIS, and CDC to provide insight on the current state of science and industry's food safety practices related primarily to food defense and product tracing. We will begin with Dr. Jim Gorney.
Thanks, Joe, and thanks for the opportunity to address this group today. I'm with the Produce Marketing Association. We are an association of about 2,500 industry members that represents the entire produce supply chain, and we are in 45 different countries around the world. We have offices not only in Newark, Delaware, which is our headquarters, but also in places like Chile, Mexico, Australia, New Zealand, China, anywhere produce is grown. So it's a great opportunity. I was glad to hear about the food safety or FSVP rule and the role the states may play in that this morning. So I just wanted to discuss a little bit about how integration of the food system really is important to the produce industry. But first I wanted to start with an overview. And I wanted to talk a little bit, I had kind of time to reflect on this issue of integration and, an integrated national food safety system. And it's really, it's all about partnerships and relationships. And the partnership and relationship that I know most about is my being married for 32 years to a wonderful woman and my wife and my daughter. And I'm still learning about relationships. So if you're taking relationship advice from a 52-year-old man, you're desperate. But here it goes. So in any relationship, there's kind of the romance period where you're talking about the future and all the wonderful things you're going to do. And I think, hearing the history this morning from Jeff Farah, I think that's really where we've been between the states and the feds over the last many years, is talking about what we're going to do in the future. And just as in a marriage, it's a great time. And the next thing is the managerial part, where you're kind of raising a family and it's all about defining roles and responsibilities. And I think it's kudos to both the states and the feds for going to that next level of relationship building, but also roles and responsibilities with the Partnership for Food Protection. I think that's a really big step forward in identifying who's in charge of what, who the responsible party is, and who's going to do what when. I think that's a really important aspect. The last step in this relationship building thing is truly integration, and I think we might be relationship jumping here a little bit because it's really not an endpoint, it's a journey with regard to integration. If you look in the lower left-hand corner there, that woman is giving the man the look. Sometimes you know what your partner is going to say even before you know what they're going to say. And you still have to be trustful, respectful, and treat each other with mutual respect. So kudos to the states and the feds. And the other issue that I wanted to bring out is certainly that this isn't a relationship between a man and a woman or life partners. This is a relationship between a whole group of people. So kudos to FDA, kudos to the states, because they're not working in a relationship between two people, it's between 50 plus entities. There's turnover, so there's relearning. So, kudos. I think this is definitely a worthwhile endeavor. And again, it's not the end point, it's a beginning. So I think this is a really important aspect. At the Produce Marketing Association, we've identified two issues. We call them places where we want to take issues leadership. And these are things that are important to the produce industry and that we feel we have some expertise in. And the first of these two are improved foodborne illness outbreak response. And certainly those of you who work in foodborne illness outbreak response know that there has been no shortage of issues associated with fresh produce. So this is an area near and dear to our heart because that needs to be improved. The second one is FISMA implementation. There's been a lot of talk in the produce industry about the produce rule. It's true, it is the first Mike Taylor mentioned it this morning, it is the first implementing regulation on the farm with regard to produce production. But there's 6 or 7 other major rules which are going to affect the entire produce supply chain, from preventive controls to sanitary food transportation to foreign supplier verification. We can't lose sight of that, and the states and the feds need to be working simultaneously on these issues. So let me take these one at a time, and I'm going to go first to this foodborne illness outbreak response. I can't emphasize enough that the issue of accuracy and speed are essential. Everybody wants to know the potential responsible party, the most likely food vehicle, as quickly and accurately as possible. And certainly, by the way, we have a vested interest in this as a trade association because we want to understand who the responsible party is, what went wrong, so we can communicate that back out to industry so that it never happens again. And also communicate that the 999 other folks who are also in that food category aren't involved. So this is a really critical aspect, and the states play a major role in these potential investigations. The other important thing is it's not an option to get it wrong. It's a huge issue, and I know there's a lot of effort put into foodborne illness outbreak investigations, but getting it wrong is not an option. Because if we get it wrong, then we're telling people the wrong advice, and you're potentially throwing folks who aren't the potential responsible party under the bus. So I think FDA's made great strides forward with the coordinated outbreak response and evaluation group that they've calved off and is specific to foodborne illness outbreak investigations, and they have specific roles in coordinating with CDC in the states. I think that's a huge step forward. It's also, from my time spent at FDA, I had the opportunity to participate in a number of foodborne illness outbreak investigations, not the least of which was Jensen Farms, Chamberlain Farms, both cantaloupe related. And what I learned when I was at FDA is how multi-jurisdictional, multi-agency the response actually is. It requires a coordinated effort, and there's tremendous efforts that are put forward, and it requires timely sharing of information. So I think you all know that already. So one of the things I just wanted to point out that most people don't understand, many in this group do, but folks in industry often overlook, is that the states really are the first responders. They're the source, and they're resource constrained. Many times, states don't have enough money being allocated to them through their legislative process, through their governor's office to get the job done. But they're the first ones out there doing the epi investigations, the shotgun surveys, doing the sampling in their laboratories, and also doing their traceback investigations to look for a common food source. The other issue is information sharing is often constrained. So unless you're commissioned, there's often this reticence. Remember, I was talking about trust, partnership, and mutual respect. I think we've got to get over this hurdle of sharing information between states, and one of the between states and the Fed also. One of the issues is when you're confronted with a foodborne illness outbreak, you get the call from FDA or CDC or the state, and you're an industry person, and you say, gee, I want to do the right thing. What's the evidence that's convicting me? What's the evidence that's compelling you to ask me to do this recall because of foodborne illness outbreak? And then the person on the end of the line says, well, I'd love to share that information with you, but the state really owns that because they're the ones who picked up that data. They're the ones who did the laboratory analysis. So the sharing of information between the potential responsible party, I think, is really important because people do want to do the right thing, but they are making multi-million-dollar decisions that are potentially huge to their particular business. So this information sharing really needs to be enhanced, and if that requires commissioning or whatever mechanism else is needed, it's really important. I also understand, with regard to media scrutiny, state departments of public health and state departments of agriculture, when these things happen, are under tremendous pressure to name the most likely food vehicle. And it's natural. I mean, the New York Times will be calling you, and everybody wants to know what the food vehicle is to protect public health in their state. And oh, by the way, of course, you have a statutory obligation to protect the persons in your state, the citizens of your state. But one of the issues that certainly pops up is that states, and I don't mean this in a derogatory manner, only have limited scope or limited vision. So if the facts of the matter the circumstances all match up within your state with regard to the traceback, with regard to the food products, it's really important that it's also matched up on a national level to make sure that if it's a multi-state outbreak, that the traceback all adds up for all the other states. It all adds up with regard to the laboratory analysis, et cetera. So this is a real issue, and I think that's why it's important that FDA is involved and CDC is involved to give this national vision to these foodborne illness outbreak investigations. All those things being said, certainly with regard to an integrated food safety system solution, increased funding for public health, I think, has to be a priority. It needs to be a priority, particularly at the state level and at the federal level. Joint training, I think Jeff Farah and Pat Kennelly mentioned this morning, the CalFIRT efforts, this coordinated response by the feds and by states officials in California and FDA. And also to involve potentially other partners. Joe Corby just mentioned it. What about our industry partners? I've actually participated in some of the CalFIRT training in California as an industry person to help explain how the supply chain or the supply web works, why people are doing certain things in produce operations. And I think we need to be able to form alliances and march hand in hand to federal and state government and not be ashamed to ask for more money for public health, and here's why. And I think there are significant business reasons why public health and a stronger public health system is really important so that we can be more accurate and faster with regard to foodborne illness outbreak investigations. Laboratory capacity, another big issue. We've got to be able to trust each other when it comes to those analytical packets, and I think it was discussed in full detail this morning with regard to making sure that when laboratory results go forward to the Fed or to other, or even the potential implicated party, that they can trust those lab results, that they're sound. So certainly that's a positive thing. The other one is post-response, education outreach. So we spend a lot of money doing research in the produce industry, in the food industry with regard to appropriate preventive controls. But the most important lessons can be learned from foodborne illness outbreak investigations. What went wrong? What were the specific series of events or factors which occurred that made the outbreak actually happen? We produce billions and billions of servings of food every day. What was unique? And that can only be found out by a robust foodborne illness outbreak investigation. That's great. The other thing that's not so great, though, is sharing that information because of company confidentiality. I'm not asking FDA or the states to break company confidentiality agreements, but we do need to do a better job of helping people understand exactly what went wrong, for example, in the Bidart Brothers outbreak related to caramel apples. It's critical so that it doesn't happen again, and we can take appropriate steps in industry. I think there's a tremendous amount of opportunity for improvement there, and working with trade orgs and other folks to get that information out. The other aspect is related to, I mentioned earlier, involving industry. So with regard to foodborne illness outbreak response, certainly sometimes trade associations are viewed as, oh, you're just a shill for industry. Well, we don't have all the answers at the Produce Marketing Association or other trade associations. But we do understand the industry, and we don't always know the answer, but we know the right person to call to get that answer. And it's not supply chains we're dealing with anymore, it's supply webs. So having that expertise come to the table and say, oh, well, yeah, that's possible. That food vehicle may have been involved, but you know what? They don't grow it in that state, or that's the wrong season. So I think involving food industry, and particularly food board or food trade associations, would be tremendously helpful, particularly at the state and the federal level. So I think those are some opportunities for improvement with regard to foodborne illness outbreak response. The second issue I wanted to really address was FISMA implementation. This is another high priority area for us at the Produce Marketing Association. And I have here, it says FDA has proposed an integrated approach to FISMA implementation. Actually, I'm wrong on that. It's actually Congress has said that you will have an integrated approach under the Food Safety Modernization Act. But I have to say, again, kudos to FDA because they fully embraced that particular charge from Congress. We believe that accessing local knowledge and expertise is absolutely essential, particularly for the produce rule. And let me explain why. We've had the California Leafy Greens Marketing Agreement. We've had the Arizona Leafy Greens Marketing Agreement, the tomato gaps in Florida, and I can go on, which were state-led initiatives for verification that preventive controls are working appropriately. We truly believe, particularly for the produce rule, that it's better to have an Aggie doing produce safety inspections than trying to teach a food safety professional everything there is to know about the farm. So they need to understand farm culture. They need to understand why things are happening on the farm, which may be different, very different from a food manufacturing environment. So we truly do embrace that opportunity to work with our state departments of agriculture and state departments of public health, because we think that they do understand the local aspects of production. They understand when crops are in season, why people are doing certain things for certain markets, and why they're potentially different in one state versus another. Speaking to that specifically, this is an excerpt from the FDA Environmental Impact Statement, which was issued in 2015 for the produce rule. Each of the black dots that you see there is 1,000 acres of covered produce. So the take-home message from this map is it was said earlier that all states are not created equal. Well, I would say the opposite. All states are not going to have the same burden when it comes to the produce rule. If you add them all up, there's about 12 states there with the black dots on them. They produce about 80% of the produce that will be covered by the produce rule. So while all states are important, we need to understand that each of these Food Safety Modernization Act rules will disproportionately affect different states. I would imagine that if you did a similar analysis for the foreign supplier verification, lo and behold, you'd probably find most of those around the major ports in the United States, because that's where the importers are going to be. So the take-home message is that we need to form alliances amongst the states, and it's going to be different. It's going to be disproportionate for each of the rules, and there's going to be different emphasis based on different states. Next, I'd like to talk a little bit about the current auditing system. The current auditing system, we certainly have some challenges associated with it. I'm talking about audits for market access. So basically these are requirements that buyers are placing on producers to make sure that they conform with current good agricultural practices, or now the Food Safety Modernization Act. So it's been said repeatedly that FDA and the states are going to work to span the role. Mike Taylor said it, I think, 1 million times, that that FDA is going to educate before they regulate. Well, this is a difficult bridge to gap, because one of the things that's going to occur is how is a state official going to be able to provide education and basically consulting advice, and also be able to take their regulatory hat off. With regard to market access audits right now for GFSI or other market access schemes, that's absolutely forbidden. You may not. You can either do verification audits or you can be a consultant, but you can't be both, because it's really a significant conflict of interest. I encourage FDA to certainly, with their state partners, AFTO, NASDA, and the states, to do education outreach. I think it's really important. But it's really going to be, they have to be very careful that they're not crossing the line there and basically telling folks how to run their facilities. You need to offer a portfolio of solutions and let folks take that portfolio and do whatever they feel is best. The other thing is how can we incorporate market access information? So all these audits that are going on, people spend literally thousands of dollars, multiple audits every year. How do we incorporate that into the program plans? Who's going to be audited? How is it risk-based? And last but not least, How do we harmonize auditor and inspector competency and proficiency? I think that's Jennifer's going to touch on that a little bit more. But it's really a challenge. I mean, if the current system was working great with regard to all the audits that we take, we wouldn't have any foodborne illness outbreaks. So harmonizing and making sure that those auditors are proficient and that they're also auditing to the same standard of conduct across the country becomes a real challenge. Currently, USDA AMS, we've been told, has been working with FDA with regard to harmonizing their GAPS program. USDA AMS does offer a low-cost, good agricultural practices, market access audit, and they are working with FDA to harmonize that with the FISMA rules. Congratulations, kudos to them, and they do work closely with state departments of agriculture and state departments of public health to do those market access audits. But I just wanted to lay down some of the challenges there. Last but not least, I wanted to talk a little bit about this concept of harmonized compliance criteria. For those of you who are familiar with the rulemaking process, you know that the Food Safety Modernization Act, the statute, is written at the 50,000-foot level. It can be pretty specific in places, but basically it says make food safe, and these are the areas which you need to do it. I have no idea. The next thing that comes are the regulations, and those are the 7 or so regulations that have been proposed so far. Those are at the 10,000-foot level. And those of you who deal in the regulatory world know that there's a lot of squishy language in there as well. Adequate. Water should be adequate for its intended purpose. Well, what in the world does that mean? So where the rubber really hits the road, and we talked about it a little bit earlier, and I was glad to see that the Partnership for Food Protection is going to be working on guidance documents, is the compliance policy guides. Those are going to be really critical for a number of reasons, because that's on the boots on the ground level. Is this in compliance or is it out of compliance? And it's going to be important in education outreach. And the reason it's important in education outreach is I can go in and I can teach the Produce Safety Alliance curriculum on the new FISMA rules, or the Food Safety Preventive Control Alliance related to the PC rule. But as soon as somebody raises their hand and they say, Jim, in my particular operation, we do this, X, Y, and Z. Is that in compliance or out of compliance? I have to throw up my hands and say, I don't know. It might be, because you've given me a case-specific situation which hasn't been clearly defined in the rules or the so that, again, FAQs are a mechanism, the compliance policy guides, the hazards and controls guide. It's really important that we get those right. So we look forward to working with FDA and the states on those as well. So it relates to training, and then also with regard to harmonizing. So if we're talking about, I was shocked this morning, maybe I shouldn't be, that 80% of the FDA facility inspections are done by states. That's an incredible accomplishment. The issue is making sure that all these new FISMA, or Food Safety Modernization Act regulations, that the verification inspections are done in a harmonized manner, so that when they see a preventive control that's not there, or they see a hazard, they know how to deal with that, and it's dealt with in a specific manner that's harmonized across all 50 states, territories, and local jurisdictions. So I think that's one of the challenges that we have, and what I'd like to make is a modest proposal. So I think we need, one of the issues that will happen also is that inspectors, when they go out to the field, and I'm speaking specifically now on the produce rule, they're going to encounter hazards, they're going to encounter routes of contamination, and they're going to encounter preventive controls that they've never seen before. They've never even thought of, and they never would think of in 1,000 years, because farmers are a really inventive bunch. They have a unique way of handling things. So they're going to be encountered with, is that in compliance or is that out of compliance? And I think we need a mechanism and a process that is consultative, as Joe's been talking about, that involves both industry, government, and academia, both federal and state, so that you've got an opportunity for folks to discuss what's in compliance and out of compliance. Does it address the hazard? And it allows you to tweak your guidance documents in a harmonized manner across all areas. It needs to be a deliberative process, it needs to be a harmonizing process, and it builds consensus. Certainly these FDA guidance documents, FDA holds the pen at the end of the day. But I guess what I'm proposing is a mechanism that may be similar to some of the things that you may be used to, which is the Conference for Food Protection, which meets every 2 years. It updates the model food code across all 3,500 jurisdictions in the United States. FDA still holds the pen at the end of the day, but there's consultation, deliberation, amongst industry, government, academia, and, oh, by the way, consumer groups as to what the appropriate preventive controls are for retail establishments. Well, why wouldn't we want to do that potentially for these new rules with regard to FISMA? If the states are going to play a big role, we need to harmonize across all those jurisdictions, and we need to have a mechanism that's deliberative before this, level 1 guidance is issued, so that everybody can have input on it. Certainly, once draft guidance is put out, everybody has an opportunity, but this is an opportunity to build consensus around what the appropriate level of care is. And I'd just like to leave you with that. I'd like to thank Joe for the opportunity, and I look forward to working with all of you in the future as we implement FISMA and hopefully on fewer and fewer foodborne illness outbreak investigations. So with that, I'll hand it back to Joe. Thank you.
Good afternoon. I'm Jennifer McIntyre with the Grocery Manufacturers Association, and I appreciate the opportunity to speak and provide another portion of the industry perspective here on behalf of my boss, Leon Brunner, who apologizes that he was not able to make it. I think, as has been said before, we're all on the same page in terms of wanting safe food. Whether you're a regulator, whether you're the producer of that food, at any point in the supply chain, we all want safe food. So I don't think there's a question about that. I think more of the question is how do we get there, and how do we have those appropriate checks and balances in place? What I did in preparation for this presentation was talk to some of our members, some of those food processors, and ask them to share some of their stories with me, and how did they view this issue of integration, and what were some of the challenges that they saw. And one of the things that a resounding theme was that they're concerned because they want to do the right thing, and yet when they're inspected, in particular when they're inspected, it's not always clear to them, it's not always communicated back to them if they're not doing the right thing. So I think there's a willingness on the part of the industry, at least on the part of our members, to make changes and to make improvements. But we need to have that discussion to understand where there could potentially be some gaps, some concerns on the part of the regulators. So let me give an example, and I kind of summarized a couple of conversations that I had here, because there were some very common elements in these conversations. So the basic example is somebody who's recognized as being from the state, a state employee, inspector shows up. And the question that's initially asked, because it seems to not always be volunteered what hat they're wearing, is, are you here to do a state inspection? Are you here to do an inspection on behalf of FDA? And the reports that I'm getting from our members is that sometimes that hat changes mid-inspection. So depending on the authority that the state has, that sometimes they're there for an FDA inspection, but then the FDA bounds are such that it would be advantageous for the inspector to really rely on their state authorities to get access to some of the records that they want. And so there's this swaying in terms of the inspection. And obviously, that results in great consternation, frustration, and confusion for the facility that's being inspected. There's the questions as to what is the paperwork? What form are you using? Which rules are you following? Am I going to get a 483, the FDA form, or is it a state form? So even if the inspection is being conducted under the auspices of FDA, it is our members' experience that sometimes it's a state form that's used. And they're not always sure from the facility level and from the corporate level what happens afterwards. What does that inspector do? And how is that information communicated back to FDA? And is there consistency in that? There seems to be some inconsistency in the language. I'll just call it the bad language. If there's an observation, if something is deemed to be critical, or a violation, or major, or minor, which of these terms are comparable? What's synonymous and which is worse? So I think that just in terms of vocabulary, there's some inconsistencies in the words that are used. And on the part of the industry, they want to understand, what do I need to do? What am I doing wrong here? And how does it compare to maybe what a sister facility experienced in a different state? I mentioned the documentation. And there seems to be, it's perceived by some of our industry members that there's a bit of a black box of what happens to some of this information, and a lack of clarity around what will be FOIA-able. So we had one member that I spoke to report that a state had come in to do an FDA inspection. They were not provided with a 483, but they were able to FOIA and find a 483 that they never got. And so I see Roberta kind of looking quite perplexed here. But these are the stories that I'm hearing, and obviously this causes great concern. And I'm glad to see that it causes concern within, at least for Roberta. And so the word that I heard time and again, as we talked through some of these examples, was confusion. It just creates confusion. Just be clear. What form are you using? Which hat are you wearing? And what do I need to do? And how do I bring this to closure? So if there's a 483, you know the time frame that you have to respond. You know how to respond. There's a process to follow. States have different processes between states, and then when it's not clear if it's a FDA inspection being performed by a state, is the response following the state path, or is the response following the FDA path? Just there's a strong desire to understand what do I need to do. And I know that there's been talk about FISMA and talk about integration in the future and how we're going to harmonize, but these are some of the issues that are being encountered today. Because our members have been regulated by FDA, GMPs have been in place, these facilities are being inspected today. We know that things will change, once FISMA is implemented, that the nature of the inspections will change, but these are issues that are present day. So integration, yes, now. Not waiting till FISMA is fully implemented, but now, and what changes can we make now? And I'm certainly happy to hear, and I think that all of our members would be happy to hear this continued journey toward integration, but can't stress the urgency of making sure that we really progress on that journey and that we don't necessarily use FISMA in guiding our timeline for integration. The industry has, at least on behalf of GMA, I would say we've not been terribly involved in this integration process. A handful of our members have been, for sure. But I think that there are many opportunities for us to do a better job sharing our concerns and sharing some of these stories and making sure that we play our role and play our part in integration. Because our facilities, our members' facilities, they're the ones that are being inspected. So this impacts us to a great extent. We have a really vested interest in integration. So some of the current challenges that we've observed, the inspection disparity. So I've given some examples of the state versus federal, inspector to inspector. We could even say auditor to auditor, because these are some of the challenges that are not just within the regulatory community, but that we face in private audits too. How do you know that the person coming into your facility knows what they're looking for? The question of competency. So this is a much broader issue than just talking about a regulatory perspective, but I think it's still a critical one, that people are trained, that they know how to perform an inspection. And I think that Jim made some really excellent points about when a visitor encounters a control or some sort of process that they've not seen before, and understanding the mechanisms that will be employed to determine the adequacy of that process or of that control. So we have, again, the example I gave between federal and state and local and tribal and territorial, but which hat are you wearing? Why are you here? Which authority are you operating under? And then some of these differences between states, because the states have different rules and regulations and processes that they follow. When you have a company that has multiple facilities spread throughout the United States, it becomes very difficult at a corporate level to sort of be managing each of these facilities on a one-off basis in accordance to those state rules, and then overlaying the federal requirements and making sure that all of these facilities are compliant with the federal regulations. So there are definitely challenges and I think disincentives in some ways to having facilities located in some states versus others because of the way the regulations are written and the way that the inspections are conducted. So some other challenges, and this is just within FDA, not even looking at the state or local level, but in the event of a recall. A larger company has an option of working with the FDA district at their headquarters facility or the facility that actually had the recall. And although we're talking about FDA and it seems like it should be one FDA, the experience of our members is it's not always. And so there may be preference for working with one FDA district over another. The information that they request may be slightly different. And this is kind of baffling because this is just within FDA. We haven't even added in the elements of the states or the local governments here. There's also just the difference in how the federal agencies handle things. With FDA, the recalling firm is the headquarters. On FSIS, the recalling firm, the location, is that facility. So we see differences between the federal agencies too. And then, as Jim mentioned, where do you go for information and who has what information? When do you need to go to the state? When do you need to go federal? And I haven't even talked about when do you need to go to CDC versus FDA. And it does seem that it would be tremendously advantageous for everybody to be on a level playing field, to have access to all the relevant need-to-know information, particularly when critical decisions need to be made. So, some of the FISMA-related challenges, because we do need to plan for FISMA. Our members absolutely are planning for implementation. GMA has proposed to FDA to consider an option for what we'll call centralized inspections or corporate systems-based inspections, recognizing that some of these programs that will be required through the preventive controls rule are often, not always, but often managed at a corporate level, so that a facility may be implementing a program, but it's managed, it's controlled at the corporate level. And so is there an opportunity for the agency to do a form of an inspection or audit at that corporate level, make sure that the plan is sound, and then go to those facilities and make sure that it's actually being implemented? We also have requested and have been a little concerned to hear that FDA is leaning against having an appeals or escalation process during an inspection. We think this is critical not because we expect our members to be fighting FDA at every turn or fighting the states at every turn, but more because particularly as FISMA begins to be implemented, as these rules start to come into effect, I expect it will be a bit of a bumpy road, and that inspectors will be looking at things that they've never cared to look at before, that our facilities will continue to make improvements to their programs and processes, and that there will be some unknowns, and that there will be questions. I recognize and understand and think it's a fantastic idea that the inspectors will have access to the central staff, to the experts at CIFSAN, but they're not the boots on the ground in that moment and may not always be able to make any sort of a decision because they're just not there. And so we feel that it's critical, especially at the get-go, to have an appeals process. FSIS does. My understanding is that it works relatively well, and so we would look for a program from FDA that gives just that opportunity to continue the discussion when there is some debate. I'll talk in a sec about food safety culture, but that's kind of a topic du jour and one that GMA, especially through our Science and Education Foundation, is very involved in. But changing culture is not an easy thing. It's not going to be an easy thing for the industry. It's not going to be an easy thing for the regulators. It's not going to be an easy thing for us as a food safety community. But again, I want to reiterate that although some of these are FISMA-esque or FISMA-driven, the need for action does still exist today. So let me spend a moment on culture change and somebody that I'm particularly fond of, Dave Gombis at United Fresh Produce Association, once said, just kind of a side comment that he probably doesn't realize I remembered. He said, if you want culture change, you just need to fire everybody and hire all new people. And Oh, so that's not practical. It's not. But I think that his point is well taken. That people have their ideas and they have their ways of doing things, and they've been doing things the same way for decades. And what would motivate somebody to change? I think we have an inherent resistance to change. Even if we think maybe it's the right thing to do, it's still hard to change. And I'm not quite sure how we will make this change in culture that Mike Taylor has talked about extensively. So we're looking for, and I think some of the key elements here is to recognize that we're not looking to place blame. I don't think that the regulators should be looking to place blame. Let's look at the facts. Let's try to agree on the facts, and let's try to get back to my first slide, which is that understanding that at the most fundamental level, we all want safe food. One of the concerns that I have personally is around environmental testing. As a food safety professional, I've always advocated, when I was on the consulting side, to use that seek and destroy mentality. When a client would call and say that they had a great environmental testing program, they never found a positive, I knew they had a terrible program. If you have a great program, you should always find a positive, at least once in a while. But we cannot afford for the industry to be penalized for taking that aggressive approach. And so I am concerned that as inspectors come in, that they may not understand that finding a positive is the right thing, that is the demonstration of a responsible facility with a robust program. Now, if they're finding a whole bunch of positives every day, that's a different story. But I think that understanding the philosophy and again, getting at that culture and what a true food safety culture means is very important. And this should be a journey. This should be continuous improvement. Something that we talk about, always raising the bar, getting better and better, and pushing ourselves to be innovative, pushing our members to be innovative with respect to food safety so that we can continually improve the food supply. Another challenge that I think exists today is that the states, they are different. They have different authorities, and we see how that manifests. If you are a facility in Georgia, depending on the type of product that you produce, a manufacturing facility, you may be subject to finished product testing by the state. That doesn't exist in the other states, and so it's kind of why would you want to have your facility in Georgia? And this, of course, stems from the PCA issue, and so you can understand the rationale from the state's perspective of implementing this, but it does mean that Georgia is different from the other states. At the other end of the spectrum, again related to PCA, we saw that in Texas, they had the authority to do things that the federal government did not have. And so then it was advantageous that the state had different authorities there in Texas. I've heard that Wisconsin is considering piloting a program around environmental testing. And so again, I think that as we look at what is food safety, and is there some truth around food safety, that we can all agree on what food safety means, what food safety is, hopefully we'll come to a point where we have fewer state-by-state differences. So what GMA requests, kind of what we're looking for, is reconsidering that general inspectional approach and thinking about how, as the industry progresses, how inspections can progress too, be they federal inspections, FDA inspections that are being performed by state or local officials, bona fide state, local inspections, and how do we achieve that consistency so that as a facility is inspected, they're being inspected with food safety in mind, and that means one thing across the board to everybody, a common understanding of food safety. What's critically important is that we have an effective and transparent process. I think many of the challenges that our members face could easily be addressed by communication, recognizing that in some cases it's the laws, it's the rules that prevent communication, but communication is key. That's where things seem to break down. And just knowing what do you want from me, what is expected of me, would go a long way. The educate before you regulate, yes, it's true, and I'm certainly a believer in that. And I know that FDA has said that time and again, but eventually we're going to be regulated. And we're probably going to be regulated before everybody has been educated. That's a fact of the matter, and that's part of the reason that I think that we need to expect some bumps in the road and be prepared to not make accommodations that would ever do a disservice to food safety, but I think that we need to recognize that not everybody is going to be up to speed at the same time. So in order to move this conversation forward, I think having this conversation is a great thing. This event here today, I was in some of the sessions this morning. It was strikingly well attended, which is, I think, a great thing to see. The industry, and certainly GMA, does wish to further its relationship with AFTO. I think that we're in great communication with FDA. It's very difficult to have interaction with each and every state individually, and so having an opportunity for the associations to work together to discuss some of these issues and find common ground is something that GMA would certainly like to do. We want to have a focus on the effective implementation and enforcement by using some of the groups that do exist. Pew assembles food industry stakeholders, food safety stakeholders. The Food Safety Preventive Controls Alliance is developing the curriculum that people will be able to be trained to be qualified individuals. IFPTI was mentioned. So these groups have already been stood up. Making sure that everybody is engaged and interacting and that these forums and venues can be used to further the discussion is, I think, where we can take things. We would offer an opportunity to leverage the industry. Our industry, many members, many facilities, do get audited to one of the GFSI recognized schemes. Auditor competency is recognized as an issue within GFSI, and so there are opportunities to train there. And I think that if we do have a fundamental understanding of we want safe food, it shouldn't really matter if you go to if you're a regulator who goes to a GFSI training. You know, we should all be learning about food safety, and we should all be learning how the other views food safety. We also have, again, our Science and Education Foundation, which education is in the name. It offers training. And so I think opportunities where industry and regulators and other food system stakeholders can sit side by side, hear the same information, and have a forum for a dialogue would definitely be advantageous. So with that, if there is time, I will turn it back to Joe to take any questions. Thank you very much.
I would invite you up to the microphones with any of your questions, or better yet, if I know we have a large number of people here from industry, if you would like to voice some issues or concerns, we would truly like to hear them. Yes?
Yeah, hi. Ron Klein. Jennifer, I've got a question. Have you brought your concerns about the lack of clarity about whether it's a state inspection or an FDA inspection or inspection conducted under two sets of authorities? Have you brought that up with the state before?
We have a we have a bunch of members. We have work groups and committees that they divide themselves into, and one of them is the inspection and enforcement work group, which is led by Lloyd Hantz at GMA. And this is a topic of discussion within that work group. And when there are opportunities to offer comment around inspections and enforcement, it's within that work group that they try to provide these examples. I do have, I've only been at GMA for 6 weeks, so I can't say that I have a ton of historical knowledge here.
Okay.
But I will say that the team at GMA has been very open in sharing the comments that have been submitted to the docket that do document some of the examples that I described.
But, you bring up some very interesting issues that I think bear discussion. It's complicated in that I come from the state perspectives that you've got states that have independent authorities in addition to FDA authorities. But one thing that I'm from Alaska that I found, we had a very close working relationship with the Seafood Producers Association because seafood is a primary industry in Alaska. And so at least at that level we were able to have an ongoing dialogue on issues such as what you're describing there.
And I think that, we all probably could do a better job. I think GMA could do a better job. Again, working with AFTO, I understand that Shannon Cooksey had met with AFTO last year and does intend to, continue to have these discussions so that, sometimes we just talk amongst ourselves and we just kind of complain amongst ourselves. But having an opportunity to share some of these frustrations with the people who can make a difference, who can say, oh, there's an easy fix to that. Again, it comes down to communication, I think.
Other questions?
Hi, my name is Deirdre. I'm Schleniger. I'm from Stop Foodborne Illness. I'm the CEO. And I just want to say thank you to everybody in the room who's doing so much great work around food safety. We really appreciate it, and we represent consumers every day. We're doing a lot of speaking around the country with industry to help establish the reason why behind food safety. And if anybody is interested, we're working with regional groups of FDA, and we work with Wegmans and Kroger Foods, developing some training videos. And so if anybody is interested, feel free to contact me.
Thank you, Deidre. Anyone else? I know I enjoyed this panel. I have a page full of notes that I took, and I also noticed that Roberta was writing a few things down, so I did gain a lot, and I thank our panelists very much. Thank you.
Thank you.